The province has found a new proposed location for Manitoba's first consumption site. The proposed location is now 366 Henry Avenue, so it's west of Main Street, it's north of Logan, and it comes after the NDP government backed off their initial proposal to put the site on Disraeli Street after local residents raised some concerns. So this is just a moment of Wab Kinew, our premier, saying Friday that this location was probably the best thing the province could do to balance the considerations of the community.
We found a location here that's close enough to where a lot of the other services are in the region, where there is a lot of need clearly in the community, but also it's maybe set back, we could say, from some of those other places where we know kids or families are going to be in the area.
So that's Manitoba Premier Wab Kinew. The consumption site will, to be clear, not supply drugs. It will allow people to inject drugs, and there will be staff on hand to respond to any overdose moment. Kinew says the facility is part of Manitoba's strategy for harm reduction. We did speak to a nearby business owner who has some concerns. Pampanga Restaurant and Banquet Hall is across the street from the proposed site on Henry. She says, her business has already been subject to some vandalism, to people soliciting, and car break-ins. So she's not only concerned about the effect that this site will have on her restaurant, she also says she's concerned how it could influence people at nearby Siloam Mission. Here's just a minute of what she said to CBC's Gavin Axelrod.
To be honest, I'm not really a fan of it, just because of where we're already located and what's around us. Just having that and what we have right now, I just don't think that would be a great mesh. And there's a school over there, like right across the building. And with the struggles that I already deal with day to day, I just don't think it would work.
You sort of know about a safe consumption site. What did you know before today?
Nothing. I knew nothing, and I don't know too much about it. So, yeah.
How much of a role do you think the government has to play in making sure the public is educated and actually knows what's going to be going on in that building?
100%. I think they should let everyone know and be very out there, just saying, hey, we're here to help, but also this is what's going to happen, and putting it in an area where it's it's central, but it's also so close to another location that people go to and resort to help. And then now you're adding people who are allowed to do that. Now they're let's just go there. That's not helping these people who are already maybe possibly struggling. It's just too close to that area.
So that is Kelly Miranda's perspective, manager of Pampanga Restaurant and Banquet Hall, across from the proposed supervised consumption site. The school she mentioned is Dufferin School. She said straight across. We just were looking at a map. It's about 5 blocks west of the site, but it is on the corner of Salter and Logan. Joining us to talk through this, Bernadette Smith is Manitoba's Minister of Housing, Addictions and Homelessness and is in studio live. Thank you for being here.
Thanks for having me, Marcy.
So why that location?
People are using in and around that area, and Winnipeg Fire Police and paramedics have, responded to the majority of calls in that area. We know that we had 570 deaths last year. A good portion of those were out and around that area, but we also know that not only people are dying in the streets and overdosing in the streets, we know that people are overdosing in their homes, and we know that people need access to supports, and this is exactly what this site is going to accomplish. It's going to give people a place to consume, but a place to access resources, primary health care, mental health supports, a place to get access to housing, and someone with compassionate, caring support that is going to build relationships and help people realize that they have potential, that they can get onto a path of recovery, get their lives back on track, get their kids back if that's what led them to where they're at, deal with the trauma that's led them to why they're dealing with what they're dealing with, and really help them aspire to be the best person that they want to be.
Finding the location's been a challenge. Obviously, you had a location in mind, heard from community, chose this location instead. And now, again, we're hearing a business owner here saying that she has concerns. How do you speak to her concerns about the school nearby, and also about her feeling that, Siloam is right around the corner, and how does this fit into the population that's already there?
Yeah, for sure. And it's a proposed location, right? And we have to follow federal regulations, and you have to have a site with a address, and that's exactly what happened with Disraeli. So we have consultations, we listen to the community and their concerns, and we certainly heard the concerns of the community at Disraeli. So away from schools, away from daycares, we put in a 250-meter policy. So it's certainly outside that radius. We want to make sure that we were listening to that. We looked at other jurisdictions. So when I was in opposition, I went to many other provinces, looked at what they were doing, and safety and security is absolutely number one concern for us. So we
how
are
do you
listening.
address it? What do you do?
We are working with the police. We are working with Downtown Community Partnership. We are looking at working with Aboriginal. Well, we are working with Aboriginal Health and Wellness. They will have community wellness ambassadors to make sure that people are coming in, and then certainly enforcement is number one. We do not want people using in and around. We want to make sure people are coming inside, accessing those services. And right now, people are using openly everywhere, in parks. You're driving, you see people, hunched over. You see people using openly.
So when you hear Kelly Miranda talk about being concerned that population will be at greater risk, your perspective is that's not necessarily the case. That population will be, tempted somehow to use more because there's an indoor facility?
Our perspective is that we're going to lead people to the services and supports that they need to get them onto a path of recovery and get them onto the life that they want to live. Nobody chooses to be addicted.
Have you had consultations yet with people in that area?
We have not. We've sent out invitations. We've certainly heard from people that were concerned that they didn't get an invitation, so we reached out to them, made sure that they got invitations. And we want to hear from Manitobans. Certainly this was a mandate that we heard from Manitobans. They wanted to see a place and a space where people can use, but most certainly get the resources and supports that they need.
So you have a meeting, I think Salome Mission December 9th. There's an in-person meeting. There's a virtual meeting on December 11th as well. After those meetings, how much opposition would there need to be for you to consider moving it yet again? Because, after Disraeli, that's what happened. Could this possibly not be where the site will be?
Yeah, we continue to take that feedback, listen to that feedback, and certainly, we look at what the concerns are. And our number one concern, again, is safety, security, but we want to keep Manitobans alive. We come from a harm reduction approach. We come from an enforcement approach. We come from an education approach. And certainly we want to make sure that we are getting those folks to the supports and recovery. And recovery is, something that people haven't had access to for a very long time. We've put over 800 new spots into the system. We're putting another 400. We're building pathways so people can get straight into detox and recovery. We want to ensure that people are getting the supports and services that they so desperately need for so long. It's part of Your Way Home strategy, getting people, connected to housing and wraparound supports and stabilized.
If I may ask you a last question, I'm going to push Josh's news headlines for a second here because this actually is probably something the news department wants to know. It hasn't even been a week since the new detox center has opened, right? The 72-hour center. How was the first weekend? Can you share with us how many people or anything about how it went?
It's been successful and, we haven't had any concerns. And basically, this is just an extension of what has been already happening at Main Street Project. I know there were a lot of concerns from the community. And again, this is just, given more authority outside of alcohol for other substances. And it's going very well. It's been successful.
And do we, Minister, have any numbers to how many people went through this week yet? Or
no, we don't share numbers because, it's people's privacy, right? And we want to keep that privacy, their own privacy. So, again, this is about getting people the services and supports that they need so that they can get onto a path of recovery and support them and meet them where they're at. And Manitoba is trending in the right direction. Provinces are looking at us and saying, what are you doing there? How can we do this in our province?
And how are you measuring it being successful? That I'm just curious.
Ensuring that, people are getting the supports that they need.
Is it because you haven't heard issues, though, out of the first week? Is that what's making you say it's been successful?
Yes.
since it opened?
It's successful in that way. People are accessing those services, relationships are being built, and we're going to continue to build on that model.
Okay. Well, thank you very much for your time live today on CBC.
Thank you as well for having me.
So that is Bernadette Smith, Manitoba's Minister of Housing, Addictions and Homelessness.